In this short video, we'd like to give simple information about the heel rise test. The heel rise test is raising and lowering onto the ball of your foot. And we can see data here on estimating the Achilles tendon force represented in this curve. And we can see that the force is estimated to be the same on raising and lowering. We can also assess two different things. We can assess repetitions, which is most commonly done, and we can also assess height. So let's talk about repetitions first. We can see some different studies here, and the average number of repetitions achieved by young athletes, quite high, but a lot of variability. And then again, just older adults, here the age is up, so somewhat less at 30. And then here's across different ages where the older people get, then the fewer they perform. The numbers here are slightly less because the patients weren't allowed to have as much upper extremity support when they did the heel rise test. So given upper extremity support, you would expect these numbers to increase. We can also assess height. So this is a study by Dr. Chimente and myself that we did in 2014, and we measured heel rise height in young controls, elderly controls, and people with acquired flat foot problems, so a foot problem of the mid-tarsal joint. And we can see is that the young people were able to achieve heel heights that were typically 50% of their foot length or higher, up to about 90%, and that elderly controls performed a little less well, and that people with foot problems performed much less well. So the peak heights that they could get to are around 70% of their foot length. And so what this suggests is that the foot itself contributes to heel height. So that's a quick summary of some simple aspects of the heel rise test. And just the important point is that the forces are the same, up and rising is lowering, and that you can have two ways to assess both repetitions and height.